And on the line right now is Health Undersecretary and Treatment Czar Leopoldo Vega. Good morning, sir. Thank you for taking our call.
Good morning, Ria, and good morning to all the listeners and CNN.
All right, Dr. Vega, could you talk to us about the occupancy rate and of hospitals and isolation centers? Do we still have enough beds in the NCR plus bubble?
You're right. Comparing this with the March 25 of last month, 2021, and of April 25, this day, current. And I think the most important and very significant factor is that there has been a decrease in and plateauing of the healthcare utilization rate. In fact, the healthcare utilization rate has dropped down from very high from March to about 76%, which is now roughly about 65% at the current April 26. And the intensive care units also has slowed the decrease in the utilization rate and plateaued also up to this time to the level of 71%. This is roughly compared with the beginning of March 25, wherein we did have a high risk category at that time, and that was at about 78 to 79%. So we're still not out of the woods. We're on the fifth to the sixth week, but we're trying to make sure that all of the institutions or the health facilities can make the necessary allocations for access for COVID-19 patients.
Speaking of the patients, of course, they need people to take care of them. Can you talk to us about the lack of healthcare workers, especially in private hospitals? How much of a problem is that still?
Yeah, right. With the present surge right now, and I think with the directive of government that the private and the public sector must at least allocate, especially for the public, about 45 to 50% of their authorized bed capacity to COVID, and the private from 20 to 30%. That would need, in terms of making sure that you have the necessary specialty units like the ICU, it would demand healthcare workers. So the Department of Health has strategized that we must be able to support this kind of increase in the number of bed allocations. So we have started to position. In fact, this is an approved. We have almost 3,500 positions ready for the healthcare workers in the NCR. And about 67% of this has already been taken, and these healthcare workers are now deployed to the different institutions. The other strategy is asking for deployment coming from low regions with low risk category of COVID. And we have last week we had almost 170 plus of deployed healthcare workers coming from Visayas, and they have been stationed in the different facilities in the institution. So at present, right now, we are still currently hiring healthcare workers, both for public and private, to meet the demands of the present surge.
All right, sir, do you think at this point, because we are seeing, as you said, a very, very subtle decrease, with that, is it safe to relax quarantine protocols?
At this time, it's too early to say that, because the decrease and the plateauing, it's still moving towards a direction wherein it should probably decrease, but we're still not seeing that. So I think it would be best and prudent if we are able to make sure that we can still keep the healthcare utilization rate in this category. But it also means that we need to ramp up more of this, especially with the ICU beds, so that if ever the economy opens up, the healthcare facility would be open. The healthcare systems would be open.
Right, so we still need to get that to a manageable rate. Sir, thank you for your time this morning. That was Health Undersecretary and Treatment Czar Leopoldo Vega.